It's not a clear-cut answer, but I think that people have to understand what they're buying. But it doesn't address the main problem of healthcare, and that is the issue of finance and how much it's costing the country. And there's really two reasons costs are going to continue to go up unless we do something. One, we got more older people, and two, we've got more things we can do for people. And all of those things cost money, and it will continue to drive up the cost of healthcare. We need really to figure out how we have a more efficient system. And really, I see the opportunity to do that is through consolidation, which you're seeing across all of healthcare right now, and also use new technologies.
In the past, we've talked prescription drug prices.
Yes, we have.
Have your views evolved at all? You seem to. I don't remember you being as critical of the drug industry, because we both understand how expensive it is to develop a drug. But there is clearly. Companies maximize profits. They're always going to try to do that. And the government, if it gives the drug company an unfair advantage, I don't know what the right number is for patent protection and extended patent protection or whatever, but is competition working the way it should as far as pricing of drugs?
Well, competition, it has to be more on an international basis. Right now, we are paying for the cost of development for drugs across the world. And we pay substantially more for the same drug than countries all over the world do, by sometimes a factor of 10 or 20. But
how do you fix that? And that's not what we're doing. That's what they're doing over there with price controls.
Okay,
right?
So we have an international market in lots of things. Oil, you name it. Why should we not have that same?
Why don't we?
Because of the government protection of that.
Right. I feel like pharmaceutical companies have not pushed back hard enough against those foreign governments because we've been able to subsidize them. I mean, couldn't we use the WTO, the vaunted WTO that everybody loves to talk about? I mean, there's got to be a way to convince wealthy countries that they should be helping to foot the R&D bill in the world.
Well, one of the things we could do to drive our prices down is to allow import from other countries.
That would be importing price controls, though, right?
It would be well, it's not price controls. I mean, that's what the market in that particular country says they're going to pay for a drug. And people are not dying in Canada because they're bad drugs. And they're paying much, much less for the same drug than we do. And I think that would put enough pressure on the pharmaceutical companies in the United States so that we begin to see a change in the prices.
But the quality of care in the United States is still probably the best in the world. Is that right?
I think the quality of care in the United States at somebody who is really ill and has cancer or heart disease or something like that, at the best of the best is good. However, our statistics nationally, as far as infant mortality rate and so on, are not great. Interestingly, if you take what we pay for health care in the United States, which is more than anybody else does, and you couple it with what we pay for social programs, and compare it with the developed countries around the world, we're about in the middle of the pack. So they're spending more on social programs and less on health care. And the social programs, frankly, are driving down the cost of health care and by the social determinants right now.
You said we talked about the opioid crisis, because the infant mortality that you just mentioned, I think that's not necessarily apples to apples, obviously, because of obesity rates and drug rates and everything else. I don't know if it's an indictment of our healthcare system or I don't know. We're an embarrassment of riches. We have so much money and free time. I mean, food is not necessarily the issue. In fact, obesity is more of a problem than malnutrition.
I think you've hit on something really important, and that is, if we just recently, a group of us sat down in Aspen and talked about chronic disease. And if you take chronic disease and you begin to look at what the major causes are, one of the major causes is obesity. It causes cancer, heart disease, orthopedic problems, you name it. And we are getting more and more obese as a country. We're now 40% of the people in the United States are obese. We have to begin to address food and sugar in this country because a lot of the problems are at the end of your fork.
What do you think of that, Joe?
I don't know. I think anything in moderation. I don't know whether sugar is directly correlated anyway with. It's not directly correlated with certain other things where it's always mentioned by some people that it's correlated. But obviously the way we eat here. I mean, the fast food nation isn't great either.
No. No, it's not. And the way the food, the amount of food that we have, the amount of lack of exercise we get is just driving up.
It's lifestyle.
It's the lifestyle, and it's spreading across the world, and you're starting to see it happen in places like India and Japan and places.
Opioids aren't helping. I mean, how can we? You don't have an answer there either. Have we peaked?
As far as obesity is concerned?
No, as far as the opioid epidemic, are we on the other side of it?
I think we peaked. I think we're starting to see the understanding of the problem get to the point where people are certainly prescribing fewer drugs, and people are recognizing how serious this is. But the other issue is coming in. Their drugs are now being laced with fentanyl and carfentanil, which are highly potent. Carfentanil is 10,000 times as potent as morphine. And these drugs are getting laced, and we just had an outbreak of deaths in Ohio from the drugs being laced with very potent carfentanil and fentanyl.
A lot of things to consider. So you're figuring things out in Aspen. That makes me concerned.
Well, it was a group of very good group
Right,
of people.
Jason, you know what I mean? I mean, a bunch of
Experts came together for 2
Can I
days.
just ask you one question?
Don't-
Because we were talking about BBD
Yes.
before, Buffett,
Bezos.
and Diamond, all teaming up together. If you were to handicap whatever you think they're trying to put together there and its success rate, what do you think is going to happen?
Well, I think
gotten a
first-
lot of headlines, but I don't think we know where this is all headed.
Yeah, I don't think we do either. But I think, first of all, you've got 3 great organizations with great leaders. And you've got Atul Gawande, who is a superb thinker and very innovative. And I think that probably you're going to see a bunch of people hired underneath him to help. But so I think you've got great people coming together. Whether they're going to be able to make a major difference or not, I don't know. But they only have about 1 million employees amongst those 3 companies,
Right.
which is not a very big cohort. I mean, we look after at the Cleveland Clinic 2 million patients a year, just to put it in some sort of perspective, and we're just one hospital.